Hello, happy Good Friday, everybody. Hope you're having a good Friday. Today, everyone's off. So, what better way for you to use your time than for you to learn about how to get rid of the cavities? And that's why I termed today's podcast Cavities Be Gone, as you can see here. Cavities Be Gone. Now, I covered this in another podcast, but I did add a little bit more. So, if you did tune into the previous podcast with regards to how to use xylitol more effectively, this adds to it. So, this is the addition, this is the bonus. And as you can see here, I did change the slides a little bit, and I actually added some slides. So, it is beneficial. I'm going to add, and I also added some scientific studies to prove how xylitol is actually really beneficial to your oral health. So this is how we're going to get started. It's 7 p.m. Today is March 29th, and today we're going to be talking about cavities be gone. The reason why I'm talking about cavities, I really have to explain to you why I'm talking about cavities. It's because cavities are literally the one of the things that can be prevented. And I find that a lot of patients have trouble preventing these things, maybe because they're snacking too much or because they're not flossing properly or they're not brushing properly. And the majority of people are not brushing all the way to the back of their teeth. So if you were to look at, for instance, I'm just going to remove this here. It's going to show you Dexter. If you look at Dexter, most of you are not brushing all the way to like the back, all the way back to all the way to the back here. Okay. You guys are stopping it around here, the majority of you. Now, some of you do brush all the way to the back, and that's where I'm looking for the cavities, but I can't find them. And so that's the first step. But this is the reason why I'm doing this podcast about cavities, is because it's like one of those things that should not be happening, but they do happen. And so if you're a frequent snacker, or you're not brushing properly, or you're not flossing, this is for you, because this is an adjunct. This is an additional bonus to your oral hygiene routine that's going to really help you decrease cavities from happening. And I really want to help you decrease cavities, especially in this weekend, because I know this weekend a lot of you are going to be eating a lot of junk food and a lot of sugar. So what better way for you to prevent that than for you to indulge in Spinati Dentistry's Cavities Be Gone? So I do want to mention some accolades that we've gathered over the years. We are coming up on our 5th year at Spinati Dentistry. Very proud of that. So thank you very much for your support, for your loyalty, and for being fans of Spinati Dentistry. So I just want to mention to you that we have won the Consumer Choice Awards 2024. That's for dentist in London, Ontario. Been rated #1 dentist in London by Rate MDs, and we've won for the 2nd year in a row the 2024 award for top 3 cosmetic dentists in London, Ontario. And we're sitting at 4.8 stars on Google reviews based on almost 700 reviews. So thank you very much. Really appreciate all your support and love, and can't wait to continue delivering this service and improving this service for all of you in London, Ontario, and beyond. So, can xylitol prevent cavities? This is the question of the century. Can anything prevent cavities? Well, I mean, if you're eating sugar and you're not really brushing your teeth properly, or you're frequently snacking, you're going to get cavities. So what can you do to decrease the amount of cavities that you're going to have? So you can see here, there's a trifecta, the sugar, bacteria, and teeth. And I also included that in another podcast, and I included it here. So I included this slide so that you can see, and I'm going to remove my face so you can see more clearly. So you can see here, this is the triangle. It's the triangle, the trifecta, I call it, of cavity production. Without any of these, you don't have any cavities. So if you don't have a bacteria, you don't have teeth, or you don't introduce sugars or carbohydrates, you're not going to have cavities. So here, you can see that if you don't have any bacteria, and this is the podcast topic for today, is that if you don't have any bacteria, you're not going to get any cavities. You can eat as much sugar as you want. As long as you don't have any bacteria, then you're not going to get any cavities. So this here is the trick. I'm going to put that back up here. It's the trick. It's the hack. It is the hack for your teeth. So if you had any hacks that you can tell the people, spread the good news to everyone, to all your friends and family and your coworkers, on how they can prevent cavities, literally by not changing anything except adding one thing, which is this, xylitol. Okay, so bacteria be gone, and this is backed up by research. Now, I did, and this is another slide that's coming up very soon. Xylitol has been in use for years, like decades. And so the safety of xylitol is unquestionable. It is safe. Now there's research, and this research, by the way, goes back to 1995. This is the research that I'm quoting on this slide right here, and it essentially goes back to 1995. So 1995 to 2024, that's 30 years. So I mean, it's not something new. It's not some craze on TikTok. It's not something that just came up and it's like, oh my goodness, Dr. Spinetti is jumping on it, jumping on the trend, and he's trying to advise us so that he can become more popular. No, my friends, that is not my tactic. If I want to become popular, I do other things. But that is not my tactic. My tactic is for you to prevent having cavities. So when you come see me, I don't have to deal with treating cavities. Although I would more than love to help you get rid of the cavities. It just makes my heart really sad when I see a cavity, because I don't want you to have cavities, because there's something called a cycle of fillings. It's a cycle. Okay. Because once you enter that cycle, you can't get out of it. And that cycle, unfortunately, many people don't know about it, but I'm going to tell you, and this is a sidetrack because I actually planned to talk about it, but I thought about it, and I think it's important for you to know. It is important for you to know that there is a cyclical phase. As soon as you enter into getting a filling, you're basically destining your tooth to a lifetime of restorations. That's like, as soon as you've entered that, that's it. There's no exiting it. And then it becomes incredibly difficult for you to actually not get another cavity or another filling. So that's why it's really important for you to prevent you having to have cavities from the get-go, so that you don't have to have fillings in the first place. And that's probably going to be left for another podcast. But if you have any questions, I can see some of you are watching this. If you have any questions, make sure you ask them. I'll answer them right away. No problems. But I just want to let you know that for you to prevent cavities is much better than for you to have cavities and then get fillings. Because once you start getting fillings, the fillings only start getting larger and larger as time goes on, because you're going to have secondary cavities or cavities underneath fillings. And then it's just destruction and destruction and destruction, and then a crown, maybe even a root canal, and so on and so forth. Okay, so I'm just letting you know that this is really important. I didn't just come up with this just because I didn't have anything else to do on a Good Friday when no one else is working. So research, what does research say? Research says that xylitol decreases your decay. This is 1995. I'm not joking. This is 1995. Decrease your decay, increases salivary flow, meaning the more saliva that you have in your mouth, the less stuff, the less cavities you're going to have. So increased salivary flow, increases pH. Now, let me talk something about pH here, because this is something that's not really understood very well by the common people. pH is just the level of acidity in your mouth. Now, every single time that you eat, the level of acid in your mouth increases. It doesn't matter what you put in your mouth. It doesn't matter if you're eating, I don't know, rice. The level of acid in your mouth increases. Now, if the level of the acid in your mouth increases, that increases your cavities. Just think about that for a second. So, if you eat anything, if you eat nuts, you're going to have an increased level of acid in your mouth. You're going to have increased level of acid in your mouth. You're going to harbor the lovely bacteria that are going to attack and are going to cause more acid in your mouth. And then you're going to have cavities. So then how can you prevent that? How can you increase the pH? Meaning, how can you decrease the amount of acid in your mouth? Research has shown that if you chew on xylitol gum, and actually I have a picture of the gum that I chew on, okay, so that you can go and get it. You can get it from Amazon. So if you chew on this gum, and then research is saying that if you chew for 20 minutes after you eat, okay, 20 minutes after you eat, if you chew for 20 minutes after you eat, you increase the level of pH in your mouth, and so you're decreasing the amount of cavities you're gonna have. So you can see here, it also kills the bad bacteria, which is mutans streptococci, as you can see here. It's called MS. It reduces periodontopathic bacteria, the ones that cause periodontal disease or gum disease or periodontitis. It reduces plaque levels, meaning when you're chewing on this gum, you're going to have less plaque. So next time you go to the hygienist is going to congratulate you on you doing such a great job, because you're not going to have as much plaque because you're chewing on xylitol gum. And she or he is not going to know your secret, because your secret is you're listening to Spinetti Dentistry. And you're listening to Dr. Spinati because he's giving you good advice on a daily basis. And so, but you obviously you're not going to tell them that because it's going to be between us. Hush, hush. Wink, wink, nudge, nudge. Okay, so it also reduces erosion of teeth. Why does it reduce erosion of teeth? It reduces erosion of teeth because erosion requires acid. Do you follow? So because you're increasing your pH, meaning you're increasing your basidity, you're decreasing the acid in your mouth, you're going to decrease likelihood of you having erosion. So if you're sipping on, I don't know, you're sipping on Coca-Cola. Okay, forget about Coca-Cola. You're sipping on some kind of carbonated drink that is acidic. And then you're like, okay, now I have to decrease the acid in my mouth. You pop some of that gum in your mouth and you chew on it for 20 minutes. Magic. Now you have an increase in pH, decrease erosion in your teeth. Everyone's happy and you have a healthy mouth and you're going to have lovely teeth for the rest of your life. Okay. Now, sugar, bacteria, and teeth. We just covered that. This is it. This is it. This is the gum. So if you want to take a screenshot of this, okay, this is it right here. This is it. Pure gum. So take a screenshot. Go ahead and go buy it from Amazon. By the way, I don't own any stocks in Pure Gum at all. I wish I did because I always promote it. Pure Gum, if you're watching this, if this gets to you somehow, some way, I want to be sponsored for showing your stuff and for basically telling all my patients to chew the Pure Gum. Okay, I want to be sponsored. All right, that was a joke. So this is it. Okay, so make sure you get it. Xylitol and bacteria, like I said to you before, it has been used since 1960 on record for treatment of diabetes, and the first dental research has been done since 1970. Okay, so it's been on for over 50 years. Xylitol is natural. Like I said, it does decrease your plaque, decreases acid in your production, increases the pH, and there are a lot of benefits. Now, here's the thing with kids, and there's been studies that show that kids that consume xylitol or chew on gum with xylitol, not only do they decrease their likelihood of getting cavities, and kids, by the way, their actual teeth are quote unquote softer, or they're much more susceptible to getting cavities than adult teeth. So if kids chew on this xylitol gum, then they actually inhibit or decrease their chance of getting cavities for many, like much, much later on, even after they stop using xylitol. Studies have shown this. Now, obviously, like these research papers at the end, they say, a lot more research is needed in order for us to have some kind of conclusive, statement with regards to xylitol, but the research is there. So if you have kids and you're watching this, get them to chew on xylitol. It's very safe. Just don't give it to pets. Pets can't consume it, just like pets can't consume chocolate. Okay, so but it's very safe for kids, and I recommend it. I recommend that kids chew on it so that they can decrease their chances of getting cavities. Now, this is it. So Streptococcus mutans or mutans streptococci. That's the bacteria. It's the bad bacteria that causes cavities. The xylitol decreases bad bacteria by around 27 to 75%. That's a huge range, but just know that it decreases it. And it says here, friendly bacteria remain. I did make a joke of it in another podcast, and I put up that clip on the Instagram, so I'm sure some of you have seen it. But nevertheless, it does decrease the bad bacteria, and that's all you should really care about. And the side effects of xylitol is that it's a laxative if you overdo it, and the pet safety there is questionable. I mean, it's not questionable. You should not give it to pets at all. Recommendations, best advice. Now, here is the best advice. Chew on, like I said, chew on it for 20 minutes after you eat. The recommendation is 5 times a day. Moderation is key. However, research has shown that optimal inhibition of the bad bacteria that cause cavities is consumption in total for the day to 5 to 6 grams, and the frequency is 3 times a day. But if you're chewing on gum, then the recommendation is for you to chew on gum, 1 piece or 2 pieces of gum 5 times a day, and that should give you that benefit that xylitol gives you in terms of decreasing your chances of getting cavities, because we should all kind of not have any cavities. Okay, I mean, knock on wood, I don't have any cavities, but I mean, I know the tricks, so I'm trying to share with you the tricks so that you too can benefit, so that you don't have any cavities either. I don't want you to have cavities when you come and see me. I want you to have beautiful teeth so that, we can all be proud of each other, and all you have to do is whiten your teeth or maybe put some veneers on, whatever you want. And then you can enjoy your teeth, okay, instead of having cavities. Let's not have cavities. So you can see here, long-term benefits observed 5 years after cessation of xylitol use. 5 years. 5 years. So check this out. Research showed 5 years after using xylitol, so they stopped using xylitol, but they had protective effect of xylitol, meaning they had decreased cavities for 5 years after using xylitol. Now, if this is not beneficial advice, I don't know what is. So thank you very much for attending. I hope you're having a great Friday, great Good Friday. And I hope that you benefited and actually are going to go out and get some of that xylitol, get some of that pure gum. You can order it from Amazon and start protecting your teeth against getting cavities. And as always, keep smiling. Good night.